Hello everyone. In this video, I will discuss another developmental disturbance, that is facial hemihyperplasia. So coming to introduction, what is hemihyperplasia? So facial hemihyperplasia, that means there is an abnormal overgrowth of one side of the body part. So hemihyperplasia is a rare developmental anomaly where asymmetrical overgrowth of one or more than one body parts are seen. It actually represents hyperplasia of the tissues rather than a hypertrophy. Sometimes facial hemihyperplasia can be known as facial hemihypertrophy, but it actually represents hyperplasia of the tissues. So what do you mean by hyperplasia and hypertrophy? Hyperplasia, that means there is increase in the number of cells, and hypertrophy, that means there is increase in the size of the cell. If there is increase in the number, then it is known as hyperplasia. If there is increase in the size, अगर सेल की साइज इंक्रीज होती है उसको बोलते हैं हाइपरट्रॉफी. So facial hemihyperplasia is actually a hemihyperplasia, not a hypertrophy. Hemihyperplasia can be an isolated finding or it may be associated with a variety of malformation syndrome. Next is classification of hemihyperplasia. Holm et al. In 1998 classify hemihyperplasia into three categories. First one is complex hemihyperplasia. Second one is simple hemihyperplasia. And third one is hemifacial hyperplasia. What do you mean by complex hemihyperplasia? In complex type, there is involvement of half of the body. For example, there is unilateral involvement of one hand and one leg on one side. That is the complex hemihyperplasia. Second one, simple hemihyperplasia. In that category, there is involvement of a single limb. Third category is hemifacial hyperplasia. There is involvement of one side of the face. Okay. Both simple and complex, the body part is involved. Hemifacial hyperplasia, there is involvement of one side of the face. Coming to etiology or causative factor for hemihyperplasia, first is unknown, that is idiopathic. Next, vascular or lymphatic abnormalities. CNS disturbance. CNS is central nervous system disturbances, or it can be due to chromosomal abnormalities. Then clinical features of facial hemihyperplasia. There is enlargement of body confined to one side. In the first picture you see one side of the face is enlarged. That is your hemifacial hyperplasia. Okay. Next is unilateral macroglossia. Macroglossia, that means there is enlargement of tongue. So in the second picture you see there is enlargement of tongue but only one side. So that is unilateral macroglossia. Then premature development, increased size of dentition. When we compare females and males, females are more commonly affected than males in hemihyperplasia, and both the side, right side as well as left side, both are equally affected. Next is oral manifestation. That means what are the developmental disturbances inside your oral cavity. So in hemihyperplasia, dentition on the hypertrophic side, that means there is abnormality. Basically, dentition of the hypertrophic side abnormal in three aspects. First is crown size, root size and root shape, and rate of development. Again, in oral cavity, there is enlargement may involve any tooth, but most commonly cuspid, that means canine, premolars and first molars are involved. The bone of the maxilla and mandible is also enlarged, right? So there is enlargement of maxilla and mandible. In tongue abnormality, there is enlargement of the tongue because there is enlargement of lingual papilla. Because there are so many papillas are there in the tongue region, so there is enlargement of lingual papilla. Then buccal mucosa is also involved, and buccal mucosa appears velvety and soft in consistency, and it hangs because it is attached to the soft tissue component, and pendulous folds on the affected side. Then treatment of facial hemihyperplasia. Basically, there is no specific treatment, but some patients require cosmetic surgery, but cosmetic surgery is advised after sedation of growth. Then periodic, that means time to time, ultrasound or MRI is recommended to rule out any tumors in the body part. So these are about facial hemihyperplasia. If you have any topic to be covered, please comment down below. I'll try to cover it. Thank you so much.